Welcome to our course, The Role of Epidemiology in Public Health. My name is Aruna Chandran, and I am a faculty member in the Department of Epidemiology at the Johns Hopkins Bloomberg School of Public Health, as well as in the Department of Pediatrics at the Johns Hopkins School of Medicine. We will start by discussing the definitions of public health and epidemiology, and discuss what components of individuals and their lives that we must address in order to optimize their health and well-being. In this section, we will also introduce the hands-on exercise for this course. Recognizing the importance of core epidemiologic methods in all aspects of public health work, you are asked to think about the epidemiology-related capacity among the staff of an organization that you currently work with or are familiar with. Through this exercise, you will gain familiarity in using a widely utilized competency assessment tool that you can take forward with you through your career. We will also be discussing the 10 essential public health services, which are the core public health functions put forth by the Centers for Disease Control and Prevention as something all U.S. residents should have access to. We will then further discuss the public health governance structure in the U.S., including the complexities of how various responsibilities are divided among different tiers of government, local, state, and national. We conclude this course by discussing examples from the literature in assessing the capacity of the U.S. public health infrastructure to address the core epidemiologic competencies. We look forward to having you join us.